would like to introduce, first of all, Onke Mo, who's the founder of the Centre for Social Integrity, Jonathan Bartolozzi from Mercy Corps, and Ms. Shine from Health Poverty Action, who are here with me today to discuss their responses in Myanmar and their efforts to help control and minimise the risk of COVID in the areas they work.
And thank you for having me here on this talk, and I'm looking forward to hearing from others. And my name is Onke Mo. I am the founder and the executive director of Center for Social Integrity, CSI, and we operate in Northern Rakhine State, Central Rakhine State, and as well as in Bangladesh. And the organization particularly focused on the promoting diversity, pluralisms, and inclusions through different portfolio that we have within the organization.
Hello everyone, I'm Jonathan Bartolozzi. I am the Director of Programs for Mercy Corps here in Myanmar. Mercy Corps has been working in Myanmar since 2008 on the back of Cyclone Nargis and has been supporting vulnerable communities and to a large extent farmers and vulnerable populations across the country, both with regards to humanitarian assistance as well as supporting agricultural value chains and peace building across the country. Very nice to be with you all today.
Hi everyone, my name is Shine. So I'm the Humanitarian Program Officer here in the HPA Field Office. So for our organization, HPA is mainly focused on the health issues in Kachin and the Northern Shan states. So we have been here in the field for more than 20 years. And we are continue doing lots of health and humanitarian works here with the local partners. Thank you.
What I want to do is just introduce myself. My name is Sonia Zambakides, and I'm the Fund Director for the Harp Facility, and I work for Crown Agents. As all of you know, the Harp Facility was set up on the back of the Grand Bargain in 2016, commitments to look towards localization, excuse me, to look for long-term, multi-year humanitarian funding, and to look how we could improve the way that humanitarian delivery is implemented as donors. So to this end, DFID developed and designed the Harp Facility to look at how they could address these issues, and it was a completely new way of working. So HARP stands for the Humanitarian Assistance and Resilience Programme, and the facility is what we run as Crown Agents. And the idea was to be able to directly fund local partners, which couldn't be done from DFID. The idea was to look at multi-year programs, how we can really support localization, how we can address the needs in those hardest to reach areas in Myanmar and on the border with Thailand. Currently, we manage over 42 grants and we have 23 local partners. And it's working across the areas. We look at Rakhine, we look at Kachin, Northern Shan, various areas around that are prone to flooding, natural disaster, as well as conflict. So overall, HARP has been running for 4 years now, and we've seen an awful lot of success thanks to the amazing partners like yourselves that we've had the privilege to work with. And looking at how you can really meet the needs of the people that are just not reached by traditional funding necessarily. So what we do as well is we respond to rapid crises. So the whole program is humanitarian, but there's spikes. Because it's protracted crises, there's always going to be spikes in humanitarian need, whether that's conflict, whether it's something major like at Nargis many years ago, whether it's COVID. And what we do, as soon as that happens, we bring in extra resources, be it with money and with people, to help that response and to see what our partners need to be able to respond better. So when COVID started, we were the first ones to respond in Myanmar, and came directly to partners, set up a strategy, set up a plan. And we asked Ginny Howells, who worked with us before with HARP, to come back and to lead this COVID response. So what I'm going to do is just hand over to Ginny to maybe describe the sort of the focus of the response and what we've done to date with it.
Thanks, Sonia. So I'm Ginny Howells, and I'm the Harp Facility's COVID and Emergencies Coordinator. So thank you for that intro, Sonia. So I think I'll just describe a little bit about COVID in Myanmar, and then what the Harp Facility's done, and then we can move on to the discussion. So as everyone's aware, Myanmar's had a relatively low number of COVID cases detected in the country so far. So as of today, it was 343 cases, which is relatively low if you consider the worldwide situation. But we are still kind of concerned about the health impacts of COVID, whether there'll be an outbreak in one of the camps in the country, like we are seeing over the border in Cox's Bazar in Bangladesh. And even though Myanmar hasn't had a significant outbreak of COVID, COVID itself has still had a huge impact on the country, as we'll kind of hear more about as we discuss today. So one of the major impacts, I think, has been on the incomes and the livelihoods of people. So we know that a large number of factories and businesses have closed down, both in Myanmar and in the region. That led to over 100,000 migrant workers returning to Myanmar, having lost their jobs, which put a huge strain on the country. They were then sent to hundreds of quarantine centres that were set up across the country, and we've also been supporting. And I think it's also worth remembering in Myanmar that the existing situation in Myanmar was also a challenge. So the Humanitarian Needs Overview for 2020 said that there was over 900,000 people in need, and that was before COVID hit. There's been an ongoing conflict that everyone's aware of. It's been escalating in Rakhine State, and we're also currently in the middle of monsoon season. So when we're talking about responding to COVID in Myanmar, we're responding to all of those things together. So since the start of the COVID-19 outbreak, Harp has been kind of rapidly adapting its programming and how it's been supporting partners. So we've managed to allocate with UK aid an additional £4.5 million in funding to directly respond to the impacts of COVID. And we've had a really kind of a three-pronged approach to this. So the first thing is that we wanted to try and continue the essential humanitarian assistance that the Harp Facility was already supporting. So through that, we worked with partners to adapt their grants, to reallocate funding within their grants to respond to COVID, and to make sure that the activities that they were doing, whether that was food distribution or anything else, could kind of continue, but make sure that was done in a COVID sensitive way. And then, as I just said, we also had £4.5 million to do additional COVID programming, and that was really to look at ways to prevent COVID from spreading. So we've scaled up the WASH programming, the water and sanitation hygiene programming, particularly in camps. We've looked at supporting quarantine centres across Myanmar, COVID screening points. We've also looked at lots of risk communication programming, so making sure that people across Myanmar understand how to kind of prevent COVID. And then we were also responding to the impacts of COVID, primarily the kind of impacts on incomes and people's livelihoods. So we were doing that through increasing our food programming, increasing cash programming. And the third one was just trying to limit the spread of COVID within our own operations. So back in, I think, March, we moved to remote working. We closed down offices just to make sure that we weren't contributing to the spread of COVID. So that's just a bit of background on what the Harp Facility approach to kind of responding to COVID has been.
Okay, so the next thing, I mean, that's the introduction, that's the broader picture. And as I've said, Harp is only possible through the work of its partners and what's being delivered. So if that's okay, Ms. Shine, I'd like to start with you. Welcome, and thank you so much for joining us. The complex situation in Myanmar has been described as one of the longest running civil wars in history. As we know, the humanitarian situation is extremely fraught. COVID-19 has just added yet another layer to that. HPA has been working in Kachin and Northern Shan, supporting communities and migrant workers who've returned to Myanmar. Would you be able to talk to us a little bit how COVID-19 has impacted the communities you've been working with?
Yeah, sure. Thanks a lot for the introduction. So the communities here have been affected by COVID-19 since late January 2020, when this pandemic just started. So many families have members working as migrant workers, either in other parts of Myanmar or in neighboring or other countries. HPA worked with the local health authorities at the very early stage to protect the local communities and IDPs from returning migrant workers who might have exposure to the virus. Since late January, the local villagers and IDPs started to learn about the virus through social media and TV, and many were worried since then, and fears worried resulted in lots of rumors and misbelief. Many migrant workers lost their jobs and started returning home. And families are not only worrying about issues such as, oh, what if there would be an outbreak, but also food supplies and other essential items. In late March, tens of thousand migrant workers returned. They had to be quarantined for like 2 weeks before they can go back home. Many are stranded. Lack of food, cash, and medical protection supplies. Some of them are traveling with their young children and elder family members. This caused a lot of pressure for the local authorities and the communities, worrying about the virus as well as living supplies for the local and these migrant workers.
Thank you so much for that. That's really challenging situation to work in, isn't it?
Yeah.
I mean, have you had to adapt a lot of your existing humanitarian programming?
Yeah, so for our existing humanitarian programming, for example, like our activity, like our regular activities like food distribution and cash transfer, our team conducted a survey in early April to get to know the IDP and the local communities' concerns and needs. So from the analysis, we understand that the locals were concerning more about like food security and the lack of income to support their basic needs. So for them, it would be way more helpful if they can get the regular humanitarian assistance. So we prioritized food distribution and were able to organize 2 rounds of food distribution in May and June. So the food distribution in May focused on students who studying outside the camp but came back to the IDP camp when school closed due to COVID-19. And then the food distribution in June covered all residents in the IDP camps. So, and also before food distribution in May, we work with our local partner and local CSOs to adapt the COVID-19 prevention into food distribution activities. We clearly mark the food distribution sites, make waiting space available, separate areas where people need to sign the papers and take their food supply to ensure social distancing. Hand sanitizers and like hand washing facilities were provided at the distribution sites. We also changed our like face-to-face pre-distribution meeting at the site to only print out the pre-distribution information paper and deliver it to each individual household before the distribution day. We use our poster to put up this information too, like in public area. And in the poster, it includes some basic information about food distribution items, site map, and also timetable according to each household's code number.
Thank you very much for that.
Yeah, thank you.
One last question, if that's okay. I mean, I know you've been doing amazing work supporting quarantine centres, screening checkpoints. Do you have anything you would like to add on those? Because I mean, I know that's been very challenging.
Yeah, so for this part, we are really thankful to Harp Facility supports. As for this supports, a lot of few new quarantine sites were constructed. Essential material were procured the sooner we can, and we provide the local frontline health workers and volunteers with incentives and medical protections. Though migrant workers are coming in big numbers, and there were some of the villagers exposed to the confirmed case, like in region, no local infection were found in all IDP camps and the quarantine sites.
Thank you so much, and thank you again for all the work that you are doing.
Yeah, thank you.
I'm going to move over to Ung Che Mo. I know from CSI I know much of your work focuses on supporting communities in northern Rakhine specifically, where there's an ongoing conflict. Could you tell us about how the combination of COVID-19 with the existing situation has impacted the Rohingya community?
Thank you, Sonia. Thank you for having me once again. And so it is like prior to COVID, there was already two double layer of the prosecutions and human rights violations. And one of them is like systematic, long-standing discriminations by law to the Rohingya community that's there for 4 decades almost, and followed by that onward from 2018, the Arkan army and the fight between Myanmar Tamil has contributed another layer on the community of Northern Rakhine State, and of course onward from this 2020. Early 2020, the COVID added. So it's 3 layers of the things that we are trying to tackle at the same time in a different way. And particularly those who are restricted or excluded from the society, like Rohingya community, are the most vulnerable and most impacted one when COVID hit the region. And Rohingya community has been prosecuted in a different way. That's starting from losing very basic human rights and things like that. And in 2012, there is 140,000 people that has been in IDP camps until today, and there is almost 1 million people in Bangladesh Rohingya refugee camps that fled in starting from 2017 clearance operations from Northern Rakhine State. And there is approximately 500 to 600,000 remaining Rohingya inside Rakhine State who are greatly at risk of different conflicts and different other pandemic like COVID. And one of the most critical thing there is like people cannot move from one place to another by law. Then it's a good thing in a situation of COVID because it will reduce the transmission. But on the other hand, when people cannot move, people cannot have access to the information, and people cannot have access to the livelihood, and people cannot have access to the health, access to the educations, and which contributes to make them more vulnerable than in a situation. So in Northern Rakhine State, in partnership with the funding of Harp Facility, we have been working on 2017 to support the most vulnerable communities with food distributions, non-food item distributions, and the hygiene kit distributions, integrated with the social cohesion components that promotes tolerance and harmony between different communities. So when COVID hit, it's the time also, it's almost a year at that time when people do not have access to information in Northern Rakhine State because the government has disabled or turned off the internet, and there was a lot of like misinformation, disinformation, and ongoing around, and people really do not know what to do. So we have received like quite rapid funding from Harp Facility to support the people in Northern Rakhine State while they're in critical situations. And we have been reaching out until today. We have reached out to 100,000 people with educations individually, and we have provided the personal protective supplies such as mask and such as soap and hand washing, installing hand washing stations, and also using it as an opportunity to bring solidarity between different communities in Northern Rakhine State.
Thank you so much. I mean, similar to HPA, well, to all of you, I mean, I think the work that you do is just incredible in extraordinarily difficult circumstances. I mean, I think, another layer that I know that you faced in Northern Rakhine State is how you managed an emergency response to the new displacement that's just happened now during COVID-19. So, we've had the history that's been going on. We've got the layer of COVID and then the recent fighting and resulting displacement. Would you like to tell us a bit more about that?
Yeah, sure. The recent announcement that has been made by the government, local government, there that there will be clearance operations that's ongoing, particularly in the area of Rathidaung Township, created an atmosphere where a local community were frightened, and then they were already moving to trying to find the safe places surrounding them, which is sometimes cities and sometimes the villages that could be protected in a way in their sense. So recently there is quite significant amount of IDPs that generated as a result, where the supply chain become really critical, and because of the movement restrictions as well, and it has been quite critical to find to support these IDPs right away, rapidly, because when people were fleeing from their village, at the middle of rainy season as well, heavy rain and infrastructure, road infrastructure is very poor there, so you need to take boats and paddle boats and things like that. And so the supply chain, indeed, the source of goods and service that we need to acquire to support these IDPs newly displaced has been quite a critical things that we had to deal with. And on the other hand as well, as a humanitarian organizations, we need to care ourselves, our staff, or who are in the front line, and because there's active fighting ongoing, there's COVID. So you're in a situations with multiple things that you need to be sensitive to. The challenge for us was like communicating, like really getting information from the communities, because time to time there were weak signal on the phones, and there was no internet connections, and there is supply issues. And but however, with the given contextual understanding that we have in our network in different communities there, and our acceptance and organizations that originated from Northern Rakhine State, we were able to collect reliable information to support significantly to these recent displaced communities in Rathidaung Township with food kit, with shelter kit, with hygiene kits, and with dignity kits.
You mentioned there about the communities, and what are people saying now? I mean, what sort of feedback are you getting from people? What are they talking about? Because it's years and years and layers of one more crisis on top of another, multiple displacements, within the same area. What is it you're hearing from the people there?
I think one thing, out of all the bad thing that COVID brought in Rakhine State, there's one good thing that we see, that it increases a bit of solidarity between different communities, because there were social cohesion work that's ongoing by different organizations in Northern Rakhine State that already enable to bring the communities into a consciousness zone that its community need to be harmonized in order to maintain peace and prosperity within this society. So the COVID would not distinguish or discriminate whether you're Buddhist or you're Muslim Rohingya or you're an ethnic minority. So I think there was a collective work in different townships that's in order to prevent people to import the cases, or to put particularly in a weak system like weak health system like Northern Rakhine State, to put mitigation measures together collectively. And also, if there is one coming through, because the supply chain with Bangladesh has not been stopped till I would say May, and there were back and forth movement, and people were able to work together to find a common solutions to be fitting in the given complex context there. And people, of course, like when you have long-standing systematic discriminations on a particular group, and mass human right, like gross human right violation has been ongoing on the place, and you have then a conflict between two armed groups, and you have COVID, and of course people become hopeless, and when this place is going to be safe for our next generation. So I think in a nutshell, what I'm trying to say is it's brought communities, a sense of community between different diverse community there to work together to a common goal.
Yes, that makes an awful lot of sense. There's nothing quite like a common enemy to bring people together. And I think it's great to hear that there is some positives happening, because it's such an entrenched situation that's there. So thank you so much. So Jonathan, your work with the Harp Facility has been focused on cash programming, although I know that Mercy Corps also work across Myanmar. Can you tell us about how COVID-19 has impacted the livelihoods people that you're working with?
Sure, Sonia. I think maybe starting with a little bit of good news. We have been monitoring the situation for rural communities across the country and some urban communities as well. And certainly, if we can say there's one piece of good news, is this, that despite many fears, we've seen food prices remain quite stable across most of the country, and there haven't been any drastic food shortages or anything like that. So that's, if we can say, the good news. At the same time, it goes without saying that COVID has had and will continue to have a devastating impact on many parts of the population, although it won't and hasn't affected everyone equally. And by that we mean, well, those who are employed in particular sectors, for example, tourism or export-facing industries, things have been particularly hard. There were recent studies conducted, one specific one by the Asia Foundation, which found that, out of a sample of 750 businesses, 29% of them have had to close due to COVID, which of course results in heavy job losses. And many poor rural areas where organizations like Mercy Corps work, the populations there largely rely on these remittances from these sectors. And there's a prediction that there could be a drop in these domestic so-called remittances as a result of COVID of up to 30%. So that's the domestic side. And then, as I think Ginny already pointed out, we've got the regional side of things. So a significant portion of the economy, I think we're around 4% of GDP, in fact, relies on international remittances. We have nearly 5 million migrant workers estimated, and that's around 10% of the population, which is sending back nearly $3 billion in remittances yearly. And there are predictions that those remittances will drop by 50% as a result of COVID and job losses in the region. And we've been seeing that in the communities where we work through surveys that we've conducted, where those figures are very much playing out. So this is set to have and is having a huge impact on rural communities that rely on those remittances. At the same time, we're trying to monitor what's happening from a food security perspective. And so you have a decrease in incomes and remittances, and we're starting to see some indication of households employing what we call negative coping mechanisms, which is the sale of assets or reduction in food consumption to sort of make up for the fact that income might be hard to come by, or money might be hard to come by. And we conducted a study in the Delta, actually, in the Ayeyarwady Delta region of Myanmar, which showed that prices of inputs for agriculture, so fertilizers, seeds that rural farmers are using, keeping in mind that 50% of the Myanmar population is working in the agriculture sector. So that increase in prices for inputs is certainly going to have an impact in the medium term for these rural populations, as we start to see perhaps a reduction in rural production of food and sale of food for those farming households. And then maybe a last point there is also the question of indebtedness. For those familiar to Myanmar, indebtedness is a familiar problem, but it is a reality of rural communities, and the poorest of the poor in Myanmar are indebted on multiple fronts, usually taking loans from multiple sources. And we're seeing the problem of indebtedness only increase as time goes on. So just some key points there.
Thank you very much. No, that's really helpful. Thank you, to look at the big picture. I mean, I'm glad there is some good news in that. Do you foresee that continuing, or do you see that getting impacted?
I think in the medium term, immediately we have seen some action taken by the government, which I think we should call out here. The Myanmar Agricultural Development Bank has offered low interest loans to farmers and for the purchase of inputs and so on, and that's certainly helpful. And there have been other initiatives through the Myanmar COVID Emergency Response Plan, so-called SERP, which have also been injections of cash and attempts to we support in some ways a social protection mechanism, although we recognize that 4 out of 5 workers in the country are employed in the informal sector with very limited access to social safety nets, in fact. So we're seeing, and I think many in the space and working here expect that in the medium term, things will get worse before they get better. Overall, the economy is set to shrink drastically. There are original predictions for the economy to grow close to 7% overall from a GDP perspective, and now those predictions due to COVID have dropped to less than 1%. And certainly, we expect that things will be tough for rural communities in the short run too.
Thank you very much. It would be great to hear more about your e-voucher program, because I know that there's been a sort of large-scale development program through Health and the Department of Health in Rakhine with cash, but that's been quite different. And Mercy Corps has started up the first humanitarian e-voucher program in Rakhine. So it'd be really good to hear some more about that.
Yeah, sure. So maybe first to say, when COVID all started, I think like many other organizations and the others on the call also mentioned, the immediate attention was, how can we support on the health and hygiene side of things and the aspects related to hygiene. So with our local partners in Rakhine State, 5 local partners, in fact, we mobilized and provided hygiene items and supported awareness raising activities to communities, IDP populations across a variety of townships there. But at the same time, we did, as you know, expanded our so-called electronic or e-voucher program. So for those less familiar with e-vouchers, it's a modality of assistance which connects program participants, people were working to assist, directly to vendors or salespeople, shopkeepers. So each program participant receives a voucher, which looks very much and operates very much like a debit card and has a value attached to it. It's topped up. And with this voucher, this card, the program participant can then go and use it to buy items at selected shops. So this modality is one that allows us to work very closely with local merchants, and we're able through this process to inject cash into these very rural markets, which in the time of COVID is very important, as we mentioned earlier, due to the economic impacts. So we very much see the economic impacts of COVID being, especially given, as was mentioned earlier, the fact that we've been quite lucky in terms of the number of cases in this country. Due to that, we see the economic impacts really being the ones that we need to be supporting the most in the short, medium, and long term. And I think one of the advantages of having this system in place, this e-voucher mechanism, is that we have the cards, participants have the cards, and we have the vendors in place, and we can top up those cards remotely. And it's very easy to provide assistance on a recurrent basis, which, with Harp's assistance, the Harp Facility assistance, we've been able to do at this time of crisis to top up those populations that, from an economic standpoint, had been identified as most vulnerable in certain geographies.
And I think that's key, isn't it? Thank you for that, is that we can target people who are the most vulnerable, who are not in receipt of perhaps government or more traditional ways of getting assistance. And that's something across all of our organisations that we're doing. Could you talk a little bit more about that?
Yes, certainly. I think one of the features of cash assistance these days, a lot of people are talking about mobile money as an option. And, for that, oftentimes you need a cell phone. There's many mechanisms that we're innovating with globally that require internet connection. Well, as we know, in large parts of Central Rakhine, actually most of Central Rakhine, if not all, internet connectivity has been cut out for quite some time. And although there has been a huge increase in number of owners of cell phones over the last 6 years in Myanmar, we still find that the most vulnerable households do not own or have cell phones. So trying to use, shall we say, more innovative mechanisms that rely on the internet or rely on some form of financial inclusion, which might require documentation, which many, perhaps most vulnerable households in Myanmar do not have, is something that this e-voucher mechanism allows us to sort of, work in a technical, shall we say, digital way, but at the same time, avoiding the constraints that, documentation and internet access might place on some of the other up and coming modalities that might be very applicable to other locations around the world.
Thank you very much. That's really helpful. Jonathan, do you have anything else you would like to add before I throw it open?
Yeah, I just wanted to mention one thing. We've been talking about the economic impact, and there have been some studies done, and a number of people are looking at different aspects. Some are looking at the economic impact from a countrywide perspective in Myanmar. Others are looking at particular populations in certain areas. And as Mercy Corps, with the support of the Harp Facility, in fact, we've taken the next step to try to understand what will be who will be impacted by COVID the most in the medium term, particularly in Rakhine. So we've set up in the process of establishing this Rakhine Market Analysis Unit, which will be looking at the dynamics at play due to COVID, as well as the other crises that are currently in existence and have been in Rakhine, including the conflict that was mentioned earlier, and trying to understand, well, in this context, what is happening in terms of the markets, and not only at the household level, and how could then that have an impact on households, as a next level of impact. So we're going to be conducting and partnering with a number of organizations that have a presence in Rakhine to do this analysis on a regular basis. And hopefully that can not only inform our work, of course, but it's really meant for the broader community, humanitarian community and development community operating in Rakhine, to have a better sense of what is happening with the economic impacts of this crisis.
Thank you very much for that. Okay, what I want to do now, because we've just got a few minutes left, is open this. If anyone would like to have any closing remarks on the work that they do, any comments overall on Myanmar, any thoughts for World Humanitarian Day?
Hi, Sonia, can I say something?
Please do.
Yeah, thank you so much. So for our organization, HPA, so we have been working closely with our local partner and the local health authorities since late January. And I found out the humanitarian coordination mechanism is quite important, it's important in especially during the COVID-19 period, because due to the travel restrictions, we were not able to attend some of the coordination meetings in other regions. But we suggest the importance of the local humanitarian coordination with not only the local authorities but also local NGOs. And we actually believe the coordination mechanism could do better, due to the urgency and the limited opportunities to meet and coordinate with each other face to face. HPA, our organization and other partners, working in the same areas focused on rapid response and make sure our assistance are effective and efficient. And especially for example, in some quarantine sites, for example, we only found out later that some partner also study supports the volunteers and health workers. So though we were able to organize meeting at the local level to coordinate and to avoid overlaps, I think should we receive better communication from the state level coordination mechanism, so we could have avoided some of the confusions and the potential overlaps.
Thank you very much, and that's an extremely valid point.
Yeah, thank you.
Could I follow up on a similar point there related to humanitarian coordination?
Absolutely.
So it's interesting because there are levels of coordination. And if we look at the Rakhine coordination mechanisms for humanitarian assistance, I think very much like was mentioned earlier by Aunjomo, this has been a time where people came together in perhaps a way that they hadn't come together before. The crisis brought people together because we were all living this shared experience and we're all trying to figure out, and we're all new at this. But we did notice that in Rakhine, at least, the coordination mechanisms became much stronger than they had been previously, from our perspective at least. And there was more activity in the so-called cluster system. And I can't say that this was true perhaps in all locations around the country, but certainly we saw it at the Rakhine level in our engagement. I must say, though, that I think the coordination mechanisms could do a lot better in terms of including not only international organizations, but also local organizations. So I would agree with Ms. Shine there for sure. But just an interesting point of comparison there.
Thank you.
Yeah, if I may add the last thing, I think the coordinations among different actors, UN agencies and international organizations, local actor, has been, like as our colleague here, Jonathan mentioned, it's increased. But I think the coordinations with the government has not been to the level that it's supposed to be with humanitarian communities operating on the ground. That's one thing I would like to highlight. And the second thing that I would like to highlight is that the humanitarian workers are risking every day their life to save the life of others. I think it is important that that there is these like in trying times like this, like with COVID. I think there should be a humanitarian framework to that contextualize and for like it could be country based or it could be like context based and things like that. A minimum benchmark that people would be abide by, because you need to be supporting yourself first before you support others. Like in the context of COVID, for example, if you're sending someone under the bullet at the risk of COVID, and the person would be mentally and physically weak, and I think if we are not supporting our people enough, and that's required, I think, a harmonized way of working together in order to make maximum impact of our work.
Thank you very much. Okay, that brings us really to the end of this now. It's been amazing listening to everything that you've had to say. Thank you, and the work that you're doing. From the Harp Facility side, we are only relevant because of you. So an enormous thank you. And we hope we can continue to support you long into the future.